So today I do talk about over the umbrella of what is community engaged research, but also importantly, I have two focus here. One is to focus on exploring the upstream factors. How do you determine communities prepare to engage on an issue, to address the issue? So that's the assessing the community readiness part. On the other parts, once we determine community is ready for certain solutions or certain interventions, then we move into the part, can we co-design with the communities on what is important on the solution for them. So that's how we want to approach today's topics here. But just to begin our talk, and this while I was preparing this presentations, I start with this question. It's actually one of the questions I was asking our doc students when they are doing their research methods. The first question I asked, do you feel research is always neutral? Or do you feel, especially for many of us who are doing quantitative in a way, those research, we always believe we have a very neutral or very objective way to doing our research. But what I want to say is research with the neutralities in research doesn't always exist in a sense. It's always about selections and visibilities. What do I mean by that? When a researcher decides to say, this is a topics I want to study and how I want to approach this topic. At that moment, you're already stating your voice or stating your values, how you want to carry this research. So that's I'm saying research is always very selective and also it's showing what your research is representing by representing a group of people, but also that connects to the visibility of this population of what the topic you are studying. So research is not neutral. In addition to a researcher's choice, there are some other factors. Probably we see those other factors more today than ever in the past. There are institutional priorities, funding structures, discipline or field norms. For certain fields, we value certain topics more. And also there are social values to tell us what is important research. So all those things come together telling us research is not neutral. And then that brings us to the questions. What counts as knowledge? What counts as a knowledge when we're doing the research and translate that into the knowledge? And that brings us back to why do we do a community engaged research? Because that's telling you who we want to represent in our research. Is that the view of the researcher, what we believe as importance, or should that be determined by the person you are serving, for your research is serving? They are the voice to decide what kinds of knowledge, whose experiences should be represented. And I think that's a core values, what is a research or what is in community engaged research. But are we only just talking about a very value-driven research here? And sometimes we feel that's in the ideal world. You want to do a research like that, but is that the only purpose for that? I think there's another part for it. Is about the translational gap. That is what we often referring as when we have a research that's complete or has been finished in a lab space or in an academic space. Oftentimes, it takes a very long time to actually reach to the routine care or reach to the reality world. So that's a gap we can describe as known to the do gap, or sometimes we can refer that as the bench to the bedside gap. That's what we are doing here as a research from the ivory towers, but they don't get to translate in the real world. And so that's why we're doing a community engaged research. We're trying to narrow in this gap. Although the data I'm providing here is kind of dated, but I think it's also still a very empowered or impactful statements for us to learn. A lot of time, it requires on average 17 years for research evidence to transition into the real world. And only about 14% of those evidence get to transition into the practice. So what we're talking about, this is a loss in the translations. We, as a researcher, do a lot of research here, but they don't get used eventually. And I think that speaks to the importance why we do community engaged research, because we want to have a community impact of the research. Hence, we want to bring the community in, not at the very end, say, this is the product, let me give it to you, you gotta use it. We want to bring them to the very front to say, let's develop the community, develop those research together and have the products eventually that you would like to adopt at the end. So that's why we're talking about the two aspects of community engaged research. It's a value driven, but there's also a very practical side of why we want to do this kind of research. But what do we mean by a community engaged research? This is how I would like to summarize if I go to a community organization and describing what is a community engaged research. I would say it's you're doing a research with the community, not necessarily on the community. And I do have a student ask me if I go into the community and do the research, does it count as a community engaged research? I'm looking at our audience in this room. Do you want to give a guess? Do you feel that's count as a community engaged research? If you go into the community and you do the research, do you think that would count as a community engaged research? Well, anyone online would like to chime in, feel free.
I mean, it depends on like how they approach.
Yes, it depends on how you approach.
If you're just looking for me input, like from the community partners, just like to come up with something, maybe they might kind of happen a little bit. But yeah, I mean, do you more likely consider the community partners as really the key members of the research
right.
from the beginning of the design throughout the implementation and dissemination, that becomes more true value of the community research. So
right,
I think it really depends on how much.
So yes, exactly. You bring up this. It depends, and it depends. It's not a community engagement research, meaning you go into the community, do the research. More importantly, and the biggest distinctions that we have here is you are not treating them as a research participants. They're your research partners. And in another way, I would describing this, where it's also how I explain to my collaborators. You are here, we're together to asking a research questions. You are not necessarily here to help me answer, or you're providing direct input to the research questions. So I'm always helping them, or I'm always working with them to shifting that perspective, because when we're thinking about research questions, very naturally we want to answer that. But it's more important for us to working together to say, what are the right questions for us to ask? I think a lot of time research doesn't get used where we don't see the impact of the research because we didn't ask the right questions. So that's the starting points. Having the community coming to you, and then you work together to say, what are the research questions we should ask together? And when we're thinking about the community engaged research, there's actually by different levels or different way for us to categorize their involvement or how we're understanding this community engaged. It may starting from the informed. The researcher go into the community to say, this is the research I'm doing. Then you're inviting them to consult on your research project on different aspect of it to say, if I want to recruit people in this way, does that work? Or you can invite them to participate more, to take more active roles. But even further, community at one point, they may coming back to you to say, this is an important topics we want to study. And based on our previous partnership, can we do a study like that? Then they will eventually move into the lead of the research projects. And while I'm presenting this continuum of community engaged research is not necessarily saying that there's a hierarchy and where this is a bad community research, where this is a good community engaged research. It's more thinking this as a developmental process. Not all the community, you inviting them, and they're eventually they're saying, okay, let's lead a project. No, it take a lot of time, a lot of partnership buildings. In a way, you actually maybe start from the very beginning. I'm gonna just go to the community to say, this is the research I'm doing. Maybe that connects with your interest. And I have some question for you. Would you like to answer the question to consult on my research? Now it's to do more participation, inviting them to join the decision makings. And then they will eventually feel more comfortable, say, this is our concern and we would like to do it. And they will take the lead on the projects. So I will see this as a more developmental phases and take a time for us to learning about, or for both as a researcher to learn about this process, but also for the community to feel comfortable to join this process as well. But those are just more conceptual wise how we may be categorized as a process, what we learn, what we see as a continuum of community engaged. There's also another part. See more clearly. I know maybe in the room you don't get to see very clearly what is on the in the figures. It's talking about different activities. So we want to see what is a more observable activity to know on those different process. I will share with you the paper later. It's the key 2019 paper, very good summaries of all kind of communicate engage research. They're talking about at each stages, the community may involve in different activities. So if you don't know where my stage is at when working with the community partners, and you can go back to where they are participating, and then we know, okay, this is we may add the stage of community participations, or there's more community initiated. They're participating, designing the agendas of your research, or they're sharing the equal powers to making the decision with the researcher. So that's more at the community-based participatory research, which we hear a lot of times CBPRs. So those are different activities for helping you to know, okay, which stage we're at. But even more additionally, what are the experiences the community may be experiencing this research process? So in addition to the activities, the experience may be the community may talking about, I told the researcher this is important. So I feel they're at the community initiated stage. They help answer the question, or they bring the question they want to be answers, or they participate in all the aspects from the design, from raising the question, from the design, from designing the question is the research itself, to collecting the data, to analyzing the data, to presenting the data, to dissemination, to sustainabilities. All those process is their experience of the community engaged research. So that's another way for you to knowing where they're at for the community engaged research. But more, if we're learning about there's a continuum, there's a different activities, there's a different perspective or different experiences, are we more thinking about community engaged research as orientations, or this is a methods that we use? Anyone would like to make some inputs here?
I always think about it as an approach.
It's approach.
There are various community engagement methods and tools that you might use, but it all has to start from like developing as that continuum shares, like that relational or like collaborative approach. And if you don't have that, the method isn't really there.
Right. So the differences of what I'm seeing, what is orientation, what is methods. Methods sometimes I feel is more prescriptive in the steps, how we're doing certain things. Orientation is more like a visions, how I view these things. So in general, when we're thinking about community engaged research, primarily we may view it as orientations, but they shapes how we use what, or how we choose the methods, how we deliver a methods. And so that's, I see the relationship between the two. So in a sense, when we're thinking about community engaged research, there's not that many manualized steps to say this is the step exactly how we want to follow it. So that's a part you will need to get more comfortable with when you're doing the community engaged research. But if we view this as orientations, there's always some principles we would like to follow to helping us to say, following those principles will helping you to develop the visions, or to help you to guide you through those decision making, because in research, naturally, we will have a lot of decision-making points. If we don't have a guidebook to tell you what we need to do for these methods, but there must be something as a guide for you to know, okay, this is the way we need to run this research. So I always come back to this principle to tell me how I make these decisions, and maybe and how much my decision is aligned with these principles. But although there's maybe there's no a guidebook to say how we do a community engaged research, or sometimes we just talk about the community-based participatory research, there's always some core components for us to consider of. And the first part, and sometimes we miss this part, is defining the communities. There's a different way for us to defining our communities. It could be defined by shared meanings, experiences, social context. Sometimes we may use a geographic areas to say this is our communities, or more identity-based, people with certain conditions or certain experiences, they will be defined as the boundaries of your communities. And especially for my research, I study with people with mental health condition, mental health challenges. So it's oftentimes we will refer to those identity-based as a way to choosing or to identifying who are our communities. But there's one thing that I really, really want to emphasize here is shared conditions. That is not the way for us to define in the community. And oftentimes we say we want to recruit maybe the CBPR team members, our community advisory board, we say, are you identified with a person with these conditions? That itself does not qualify to say that's defining the communities. It's their lived experiences that define the communities. And there's a differences between the two is that having the conditions is different from how the condition is lived, experienced, and interpreted in their own context. So that's a part you want to capturing using the lived experience to categorize who are your communities, as opposed to I'm going back these labels, and that's how I'm going to choose my community members to join my CBPR projects. So that's some things I always say very importantly for us to ask ourselves, who are our communities, or even go into the communities to ask how you would like to define yourself, and to have those dialogue, have those conversations about, then to better understand this is a community that we're working together. Okay. But following that, we have known this is a community, and now what? What will be the next step? What do we do? I think as Corey, you shared before, there's a different way for us to do a community engaged research. And so today I'm gonna just show a few ways I have been doing community engaged research, or CBPR kind of word. The first one I'm gonna introduce is called the Inspiring Change. It's designed specifically for African Americans with mental health challenges or mental health concerns when they work engaging in health services. And those are 3 types of different manuals, one for the facilitating, one for the workbook for the participants, and one for the leadership development for them to feeling empowered in the process of a community-based participant research. But I know, like a few minutes ago, I just said there's no manualized protocols for community engagement. Why there's a manual of that? And then I want to make a very, I think it's a very important distinction. This is not a manual to say, this is the methods we do a community engaged research or CBPR research. This is manuals for us to build the capacities to do a collaborative work. It's not saying this is a step, it's say this is a foundation we need to build first in order for us to do a community engaged research. And so in this, those manuals are all available online. You could download it and you can see if that apply to your own research. But usually in the manuals, it's talking about how you want to build that capacities with the community group that you're working with in order to build on the research projects or a research study, the community engaged one. You get them started learning what is the CBPR, what is a community-based participatory research. You're learning about the working alliance, talking about some different way of doing research ethics, how do we collecting data, what is the sustainability, while understanding the results and sharing the results and taking the action, especially the action. Social change is important in the built-in part of the CBPR research. But in addition to that, when we are talking about building the capacity building with the community to do the collaborative work, it's not providing the training. It is not providing the training to your community collaborator to say you need to catch up with the researchers because you don't have those different knowledge to do a research. That's totally wrong of what we want to do a community engaged research. It's building the capacity for collaboration on the both sides to be understanding how we want to do a collaboration. It is to make the power differences, especially of that, the roles and the expectation very explicitly throughout this process so people can feel more in a very transparent process to engage in the research and also supporting the decision-making process. In what way, when we have a research decision we need to make, in what way as a group we want to make that decision. So that is what I was trying to refer as a capacity building here. We're not saying this is a step. We're saying this is the foundation work we need to do first in order for us to do a community engaged research. So far, any questions, thoughts, or from online folks, or from Dr. Pan, your class, before we move into the next sections about the different way for doing, more specifically, for doing community engaged research? Dr. Pan? Oh, yes.
Can you provide any examples of like, if you have done any, like, is there any activities or strategies to support like a shared decision making?
Oh, yes. Yes. Some examples actually in the menus I just show you. They have outlined some worksheets for you to work through how do you want to make a decision. There are 3 types of decision making. You can work together to say, as a group, we learn about those 3 different ways of making a decisions. Then we choose which way we want to make a decision. Could be a shared decision making. Everyone get voted. That could be a very structured ways. Could be say we want to go with we want to address and reach a consensus. That's a different way for making a decisions. Or it could be we take a different approach, have listen which opinion is more convincing. That's different way for us to making a decision. So it's more for going through the process to first learning about this are the way for making a decision. Then as a group, we can choose one of the to say, yes, moving forward, how we want to make a decision. And especially for decision making, it's quite, I think that's a very, the most important factors for CBPR research, because sometimes we feel we are engaging the community into the research, but we didn't really share all those decisions. We just kind of have the decision hidden there, and this is the outcomes we reach, and we didn't make the decision making process very transparent. So I think sometimes may feel very structured, but structure providing the platforms for us to making the decision to together. So yes. Is there any other questions comes in? Okay. And also, when we're talking about building the capacities, it takes time. Takes time in terms of you need to meet regularly and work through this process. And this can also work through multiple projects. You may not build the capacities to the optimal stage in one project. Probably require you partner with one group for a long time. Then eventually you reach to the better state of how we all feel very comfortably to make decisions together too. But still, so we learn about defining our communities. We learn about building the capacities to do such work. But then how do we do that? So today I'm specifically talking about 2 type of I would say methods or approach for us to do a community engaged work. That's my current ongoing projects. As I kind of introduced at the very beginning of the talk, one is exploring the upstream factors. How do we determine the community is ready for addressing certain issues? The other one's more on the downstreams to learning if we identify the issue and we want to address it, how we define develop or co-designed intervention or solution to directly addressing it. So we start with the first one, Community Readiness Assessment. So for the Community Readiness Assessment, it has been around for quite some time. The manuals I'm sharing here is the second editions of the Community Readiness for Community Change. It was proposed by the Tri-Ethnic Centers for Prevention Research in Colorado State. This version is already over 10 years old, published in 2014. And there's even the earlier version is another 10 years before that. So it has been around for quite some time. But the ideas I really like is talking about sometimes we give the community an intervention or solution, but the community is not ready to adopt it. So they are not utilizing that intervention as solutions. So in a way, they want to say, we want to assess whether the community is prepared to address a specific issues. And then this approach providing a roadmap for us to actually produce a social change. The reason for why we are doing currently have a study on the community readiness assessment, especially for the Wisconsin Asian groups here to addressing the mental disparity for the young adults populations. This is the current project we have. Is what we have noticed is that a lot of services do exist, but they're just not used. But what explains the gap? This is a translational gap, but it's also a gap. We have keep putting all our resources and effort to say we want to have more interventions, but interventions could be very impactful. The intervention could be very effective, but they're not being used. So we want to understanding that disconnect And that's why we said maybe the community, we make a hypothesis here. Maybe the community is not ready for adopting those interventions. Or do we know the community is ready to adopting those interventions that have been created? Hence, we're doing a study on that. And let me explain more what is the concept is. I think a lot of you here have learned about the stage of change with stage theories or trans-theoretical theories about explaining about the individual change, individual behavioral change. And we're talking about for individual, they can be at a pre-contemplation, contemplation, preparation, action, and maintenance stage. And importantly, when we're thinking, if we want to motivate a person or mobilize a person to make or to adopt the behavioral change, we need to do the first steps is know where they're at on their behavioral change. And following that, we need to match the interventions to the stage in order to make that change happen. And at the moment, when the intervention you provided to the individual that exceed to their current stages, then you're going to experience the behavior resistance. So that's kind of the stage of behavioral change. But then for this model, they kind of transition the stage of the behavioral change on the individual to a community base. So they're treating a community as a person, then to understand where the community is at on addressing this issue, to taking on changes, taking on an actions. And can we align, can we first know where they're at, then have a very matched intervention to offer to the community or to design with the community together. So that's a concept here. And let me use more specific examples with some of our preliminary data. So before I mentioned we are doing a community readiness assessment with the Asian population, Asian groups in Wisconsin to understanding the mental health disparity. And specifically, we're focusing on 2 Asian groups, Hmong and the Chinese, those 2 of the largest Asian groups in the Wisconsin. What we have noticed is a lot of intervention being developed but not being used. And then throughout our studies to assessing the readiness, what we have been noticing, especially for one of the Asian groups that we have been working with, is very low awareness. So if you're not aware or recognize this is the mental health disparity is an issue to the community, no matter how many interventions you created, people are not going to seek out for those interventions. So the disconnection is not that your intervention is not impactful or your intervention is not effective. It's not people not seeing the needs to use this. So that's the mismatch we have starting to notice. We have the intervention, but people at the earlier stage, they're at the earlier stage on the denial resistant or vague awareness stage. So even you at a later stage, you have created a solution or intervention offering to them, they're still not adopting it. So it's the same as a behavior resistant. We're observing that for the communities. And so how do we want to, well, in what way we have been doing the community readiness assessments? There are, under these models, there are 5 dimensions. So what we are studying, we're studying about the community knowledge, community as a whole. What is their knowledge about the issues? The issue for my projects about the mental health concern among the young adults. So that's what is the community's understanding of these issues. Following that, what is the community's knowledge of the efforts? Efforts referring to service, referring to activities, programs, campaigns, all those different ways serving the community are the efforts. In addition to that, community climates, overall the community attitudes towards this one issue, so whether they want to addressing it or maybe they feel dread to even talking about these topics. So the community's climates, following that, the leadership, whether the community's leaders whether they are aware of this issue and they want to allocate the resource they have to addressing these issues. And then we come to the resource. What resource do we have? Maybe we're here talking about financial resource, the different donation from the community. But in addition to that, we're also talking about the volunteers, whether the community have the volunteer want to serving on the certain programs. Do we have the trained personnel to deliver certain interventions? Those are the resources we're talking about. So we're actually assessing the 5 dimensions to answering where the community at in terms of their readiness, but who are providing those information for us to do those assessment is the community leaders. And how do we understanding what is a community leaders? Does not has to be someone who have a leadership role in an organization. It doesn't defined by an official leadership role. It's more defined on individual, a community member who have deep roots in the community, who are very influential, considered as information hubs. People would go to the person to asking for advice, asking for suggestions, and that will consider as a person who are influence, who have influence to the community as a leader of the community. So some of our participants, yes, there could be the community organization leaders. We also have invited like religious leaders or educators, providers on different aspects for their way of viewing what do you see for these communities, and can you offering those information for us to better understand where the community is at. So what we have been doing is way for each of the communities, we identify who are the leaders, trying to use more, maximize the variation of the leaders there that brings in their knowledge, and have a various, a set of questions, 46 questions, a semi-structured interviews asking them to, yes, 46, I know it's a long, it's usually, the longest interview we have is about 8 hours. Yes, it's divided in 3 times, not in 1 day, not in 1 day. So it's like each time 2 hours, and then we follow up 3 times. So up to 8 hours, we're answering all those questions. So you actually need a leader who can who are very engaged and invest to stay on to answering all those questions. Yes, but it's very rich data they're providing, and they're sharing their perspective. And one important thing is, and then we also keep reminding our leader during the interview process, you are not here to share your personal perspective. You are here to sharing your understanding and observation of the communities. Because very likely when we go into the interview as a participant, I'm talking about how I feel or how I perceive certain things, but we are asking them to shifting that perspective a little bit. You are here to answer what you feel about this community, what's your understanding, to help us to better assess the communities. So that's how we have been doing through a semi-structured interview. We identify with the leadership groups from our 2 communities, the Hmong and the Chinese, and then we collect those data, and then we do a scoring to identify where they're at in terms of their stages. This is examples of how we do the scorings. So we go back to the transcripts. We identify the specific statements that align with each of the dimensions, the 5 dimensions we mentioned earlier. Then we walk through these 9 stages or 9 levels that have been predefined. For this one, it's a community knowledge of the efforts. So for here, you collect all those related statements, and then you cross-check to see, based on those statements, do we see where the community is at? You can only move on to the next level if the previous level is true, the whole statement is true, then you can proceed to the next level. So it's built on the different levels. So let's say the level 5 is at least some community member have heard of those local efforts, are familiar with those purpose of the efforts, who those efforts are for, and what is the mechanism, well, who does those efforts, how does those efforts are offered to the communities. So only your data is supporting that statement to be true, then you can proceed to the level 6. Otherwise, the community is determined at the level 4 on these dimensions. So we will do the scoring for each of the transcripts. We will aggregate all those transcripts, and we eventually aggregate all those dimensions to eventually get a community stage for the one community we are studying. So eventually, across so many hours of interviews, we will be able to determine likely this is the stage the community currently is at. Then based on the stage, then we try to map to the solutions. So if the community is at a vague awareness stage, then I think the issue here is not developing the service, it's talking about how we can raise awareness. That's how we are thinking about how we match the stage here and why that's important to match the stage here. But is that the whole study just about determining the level, determining the stage? They also bring some other additional deepened understanding of the community. I'm gonna use examples here. Very interesting. We just noticed a few days ago. So usually we're thinking about why people not engage in service, especially mental health services. One of the big contributors is stigmas. People feel being stigmatized. They don't want to engage in the research. Do our data supporting that? Yes, but there's a very interesting nuance we're starting to observe. Mental health is recognized, but they don't always be viewed as a community issues, not viewed as a strong community issue that require addressing. Mental health has only become very salient and motivate people want to addressing that is when they're observing their performance excellence has been threatened. If I don't do well at school, if my work is being affected, that is a moment I see, okay, I want to address in my mental health. So it's not necessarily the stigma per se is pushing people away from seeing the need to engage in the services. It's just how we recognize the issue becomes important. It's different for the community. For here is when my functions is being affected. That's a moment I see I want to addressing these issues. So that's kind of change our view about what we want to know more and how we want to designing our solution later. And very interesting when we're learning about this insight, it can actually map back to one of the frameworks, stigma framework actually, is what matters most frameworks. Is talking about stigma for a culture group is understood as stigma only becomes very consequential when they are actually threatens to the core values to the culture groups. So mental health itself is being threatened. It's not so much people would recognize as a needing addressing issues. It's when their functions, those are the core values to one community. Do I have a good job? Do I have a good grades in the school? Those are the core values to the community. That being threatened, they starting to recognize that's a stigmatized. It's not the mental health piece that's being stigmatized. It's the functioning piece being stigmatized. And that tells us how we want to design in the solutions. It's not just say we want to delabel or trying to counteract the stigma. We need to say how we can translate or transform the message about mental health to disconnect with a functional piece. And that's how we want to design in the solution to engage people in the services. So that's kind of the way for changing us to thinking of the service part. Yes.
There's a question in the chat.
Yes.
Yeah, hi, by the way. Sharing that one thing I've noticed in the field is that leadership is often shared among several people, and naturally, though sometimes unfortunately, there can also be cliques or tensions between groups. As outside researchers, we may not fully understand those cliques or dynamics, and could intentionally contribute to those and have impacts. So curious about your thoughts on how novice researchers might navigate situations like that and those dynamics.
That's a great question. And I kind of skipped that step, then you catch up. Yes. We actually have a community advisory group. So we don't go into the community to say, I am going to identify the community. Myself is Chinese, but I wouldn't say I know exactly who are the Chinese community leaders here. So I have at least one community partners who really knows the community. And I asking that person's opinions to say, who do you think we should start with? As the first one as a community leader to invite to the study. And through each of the interview, we do a snowball samplings. They may recommend more people to come into the conversation to recognize as leaders. And even in addition to that, there's a second phase I was not planning to cover today is we do those individual interview, we find out their stages. Our second phase is to have a group meetings. It's like a community conversation sort of meetings. We're presenting back to our finding, but in that group meeting, we're also inviting more leaders to come for them to respond to these findings. Do you agree? Does it align with what we have learned? Do you think the ideas we learned from this group of leaders that's actually representing what you have been observing? So we do have some sort of cross-validation process to building that ideas. So back to the questions as a novice researcher, how do we do it? We need to identify the first community partners. When I say partner, that feels like a big word, but it could be just one member who has been living in the community for a long time. They have keep going to those different community activity, just knows the community very well, doesn't have to have a strong influences, but they are connect to the influence people, where they know who are the influence people can point you to, that you can then, that will be your starting point to reach out to who will consider as the leaders of the communities. So that's how we may start in that process.
And for your work with, at least on this project, you mentioned that kind of finding that a lot of folks maybe are at that no awareness stage. Do you find that that's true too of like the folks who are on the advisory board? And is that like, how do you recruit for folks? Is that interest kind of at the forefront, or is it more just interest in broader Asian American voice in research, or how do you approach that?
We actually see a difference between the Hmong group and the Chinese groups. For the Hmong groups, we were able to identify people who have leadership roles, but they also are heavily engaged in the mental health services, like they are service providers. They're actually the organization who providing those services, so they can have voice on both ends, the community end and the mental health piece end. And we notice a totally different landscape for the Chinese group. And the reason for that, we don't have that much of a services exist in the Wisconsin. I think that's one of the reasons for explaining that. So we were identifying the community leaders who are deeply involved in community. We may have fewer members who can speak on the mental health piece. Those are usually the psychiatrists or providers, or sometimes could be even like acupuncturists, those very traditional way for treating people, but they engage in people in a way. So that's how we kind of pivoting a little bit, but still getting that perspective to include it here. Yeah. Do that, yes. So yes, we are here to learning about, this could be one, let's say this is the issue we notice, what matters most to the community, and that should be where we should offering the solutions. So let me make a hypothetical case, then we can transition into why we can utilize this information to a co-design. So hypothetically, let's say the community believe work is very important, mental health is a threat to my work, and then it's not to addressing the stigma of the mental health, the stigma to disconnect between the mental health threats to the work, the core value of the community, in order as a solution to addressing it. And so then I happen to have interventions kind of addressing related to that, about the honest, open, proud interventions, talking about how people communicating and share about their experiences of mental health as a way to controlling the information or impression management in a way, so they are not being seen too much connect with their work performance. Mental health can be managed to disconnect with the performance piece. So this is a hypothetical case I'm making here, is that can, let's say this is the intervention we want to develop, and we want to co-design that with the community. How do we use that methods? Then we move into the co-design phase. We want to use this existing intervention by addressing this very specific methods here. And now I'm introducing the collaborative intervention planning framework. This is a combination of bridging into the intervention mappings and the CBPRs. So it's more using the CBPR orientation to do a very systematic way of adapting or creating interventions. Let's say if our case here is why I want to adopt the existing intervention to addressing the mental health doesn't have to be so much affecting works, that piece. I go back to my advisory board, go back to my community-based participatory teams to say, this is the intervention we found, or this is a potential solution to the issue we have identified in the previous stage. Then that's, we need to do a co-design, or we need to do a development of this intervention. And so for this model, they actually walk through very systematically. So how do we do it? First, we already have the CBPR team or community advisory board. Then we want to inviting them to reviewing the original interventions. That's the original intervention we want to adapt. What are the evidence on that intervention? What are the history where this intervention has been used with different group in what context? So community member needs to have all this knowledge in order to fully participate in the adaptation phases. Then we move into the fidelity and the fit assessments. Because when we're adapting an intervention, it's important to be to adhere to the core ingredients of the original interventions. Those are the things should be remain unchanged in order to produce the effects that we can observe. But in addition to that, we need to do the tailorings to the community, to the issue, to the context. So the first things we need to differentiate is what are the things that need to remain unchanged, considered as active ingredients of the interventions producing the effects? What are the things need to remain as a target for change that's appropriate for this context, for this group, for these issues? So those are the two things you need to work with your community advisory board to differentiate first. Then you move into the material adaptations. So sometimes we may be missing this part and go directly into the adaptation and forgetting there are the pieces we cannot change. Otherwise, it will affect the effectiveness of your interventions. There are the pieces we have to change. Otherwise, it's not responsible to the community you are working with. And then we can advance into the stage how we do this very systematically. Your community advisory board at this point, they probably already have an idea what is the original interventions and what is the context we want to adapt it to. Then we need to very systematically say what are the pieces we need to do a target change, the change of the program materials that need to be adapted. We also need to link back to say why we need to make those changes. So we identify those issues for the tailorings. We identify what are the changes we need to make. What are the connected materials in the interventions, could be including the materials, the program materials, the session materials, could be the delivery materials. All those are included. That's associated materials. Then we also linked back to say, what are the specific steps for us to making those adaptations, and who are responsible for which component of those adaptations. So that's a matrix we always work through is, this is a program, this is a history, this is a goal. Then what are the things we can change? And for those changes, what are the linked materials we need to make specific adaptations? And for those specific adaptations, who are the ones are responsible for which part and for what purpose? So that's a very systematic way for us to make those changes. And eventually we can adopt its interventions to address specific issues. So, and in a very collaborative way with the communities. So yes, that